Okay, so we're back again with my friends from Amex Podiatry. They are the leaders in regenerative medicine vendors. They've got lots of good products for you, and they are here to talk about a new product. So I'm going to turn it over to John to introduce our speaker. John, take it away.
Guys, I'm John with Amex Podiatry. As always, thanks to everybody for coming out for these webinars. They're very exciting for us. So, like Twee was talking about, we hosted a regenerative medicine summit in Chicago last weekend. So, thanks for everybody that came out. I think it was really fun, exciting, educational. And one of the things that we saw at the conference was this amazing amount of excitement around Red Vive and their red light therapy. So we got to talking to those guys after the show, and we're excited to announce that we're partnering with Red Vive to bring this amazing technology to more podiatry clinics out there. So, like I said, we had such amazing conversations last week around this product. We wanted to keep the conversations going tonight, so it only made sense for us to host a webinar. So I'm incredibly happy to announce Dr. Raul Desai and Dr. Twee Ho Ellsworth to talk more about Red Vive and Red Light and all the amazing things it can do for your clinic. So without further ado, Dr. Raul Desai.
Thanks, guys. And thank you, John, team, Triple J. Thanks for having us. And, we got a lot to cover, so I'm just going to get started. So we're going to talk about photobiomodulation, another term for red and near infrared light therapy, and really kind of setting a new standard for regenerative medicine. I'll talk about a little bit about who I am first. So you're like, who is this guy on here? And maybe some of the folks we got to meet in Chicago. That was an amazing event. Congratulations, folks. That was so good, guys. And Dr. O, such a good event. But who I am, first of all, I'm a father. Co-parent of 5 beautiful children. And so, as all fathers do, we have terrible dad jokes. So I got to start with one. So why did the podiatrist get into regenerative medicine? Because they love to heal people. All right. So, there we go. So I am also a musculoskeletal radiologist. My focus was spine, joints, and soft tissues. Biologics and regenerative medicine. And, currently I am a chief scientific officer and medical officer for Red Vive Health. And so for 2 decades, I've used imaging as a musculoskeletal radiologist to really understand exactly why tissues fail, how they heal, and how we can accelerate their tissue healing with regenerative medicine. And it's been an amazing journey. So this is a little bit of my background. Again, board certified MSK radiologist, and I got lucky where I went for my training was very highly interventional. So I did spine and joint treatments, got to diagnose issues, put needles in complicated places, started using corticosteroids when I started about 2007, and got lucky and got introduced to regenerative medicine, and started with like PRP in 2008, and 20,000 regenerative procedures later. I have a wealth of knowledge. And so I was former president of IOF, which is the Interventional Orthobiologics Foundation, got to meet amazing people around the world. I've written books and chapters and publications, lectured all over the world, even at the NIH, talking about regenerative medicine for spine. Currently I'm with Redvive. We're going to see some cool MRI before and after. I'm very much kind of proof in the pudding and a very black and white sort of physician as a radiologist. I want to see that this is really, working. And then we've been, this past couple of years dedicated to Red Vive Health and working with dentistry, podiatry, kind of my wheelhouse in joint and spine medicine, and even delving into the wellness space. So we're treating all of these different areas. So how do we, these are the clinicians and the doctors that I'm able to teach. And so how do you spread? How is, there's so many different pathologies. One may ask, then how does your medicine or your device affect all these things? And that's where we can get that moniker of potentially snake oil, that, how can one thing treat all of these issues? And really it comes down to the mitochondria, right? That's mitochondrial health. And they don't really care about specialties, and they're in every one of our cells. And so what we're going to learn today, and what I would love to leave you with, is how powerful this medicine can be for both you as a human being, for your family, and then all of your patients. Because once you understand how powerful and simple this medicine, because it is a medicine, is, that you'll want to leverage it on a literally a daily basis. And so what do the mitochondria care about? They really care about the wavelength. And there's a very specific wavelength in this electromagnetic spectrum that's powerful and affects the mitochondria and helps them get turbocharged and helps with supporting inflammation, healing, cell activation, and all the things we need to live a better life. So is it snake oil or is it science? That's kind of the why maybe some folks have come here. That was the title of our lecture or our webinar. And it can be both, honestly, right? So you can use this medicine in the right ways. You can get the right dose, the right medicine, the right wavelengths, and you can apply it in a really powerful way. But you can also use the wrong wavelengths. You can use the wrong dosing pattern. You can use it in a way that, just like with stem cells and regenerative medicine and PRP, that there's a lot of clinics out there, they're using it improperly, and it can be labeled as snake oil because it's not helping patients, right? We're not affecting a positive change. But if you look at the data, we're going to go through, there's 10,000 publications, 600 plus clinical trials, systematic reviews, there's NIH publications, NASA's paid for the research, Harvard has refined it, and we have the World Academy of Light Therapy that has dosing consensus, and a place that I really learned a lot about this. This is just some information out there that's, PubMed. So you look at PubMed searches and you can see if you just put in photobiomodulation therapy, almost 10,500 results, right? If you put in PBM and pain, there's 2,300 results. PBM and arthritis, 250, foot and ankle, almost 200, neuropathy, 123, and wound healing, almost 1,700, over 1,700 studies. The other thing that's important here to look at is the trends. Like, this is not a flash in the pan. If you look at this, there's a growing literature base over the last 15 years. There's a little drop off around 2019 when we had that pandemic. And so it looked like I'm thinking that's probably where it slowed a little bit, and then the research has picked right back up. So this is something that is super compelling, that's here to stay, and we're going to talk about that. Now, to just remind me, and if anybody's interested, part of what we're going to hopefully get across today is that if folks are interested in this, this is our first introduction, our first meeting. I'm super passionate about this, and Red Vive has started a university, and we're going to work with MX as well to really provide a education for you docs. We want to make you the photobiomodulation experts for your patients, so you're able to take this. It's not about me, pontificating here on some webinar. We want to pass this education and this passion on to you, so you're able to take it to your communities and help your families, help your patients, help your communities. So what's PBM? It's photobiomodulation, using photonic energy to modulate biologic systems. Right? We're taking these specific wavelengths, we're illuminating the tissues, and they have a very specific biologic outcome. So they're stimulating mitochondria. That's the cellular, power plant of the body, increasing the cellular currency, which is the ATP. And then you're going to have all of those downstream biologic pathways that are going to be activated: tissue healing, reduction in inflammation, tissue repair. And so we kind of had fun. You heard my terrible joke before. And so here's another, bad joke, is photo business modulation. So PBM is photobiomodulation. Well, we can also leverage it, because if you have good outcomes, your patients are feeling better, your business is going to do better. And most of you here, have private practices. I had a private practice. I know the stresses that go along with that. So if we generate new recurring revenue streams, we have patients that are feeling better, they're more engaged and empowered, they're taking this medicine home with them and feeling like they're empowered and making a difference. It positions your clinic as a market leader, and you have more success, more patients, more freedom. And so that's, our passion. My introduction, actually, I think this might be a good spot, Dr. Ho. In this, as far as like I was going to introduce you a little bit later, but I think this is a really natural segue to talk about your experience with Red Vive, and then I'm going to jump back into some of the science and my experience with it. But I think, looking at, where we can talk a little bit about it, I'd love for you to talk about your experience.
Yeah, so my interest in PBM started from a vanity standpoint for like years ago, and using a red light mask. And then when I got introduced to Dr. Desai, I thought, oh my gosh, if I can get a whole body panel and treat, the whole body and provide this to my patients, this would be amazing. And so That's exactly what I've done. And it's really incorporated seamlessly into my practice, because the way I discuss it with my patients is, okay, and I think a lot of you that are on here today are already using either laser therapy or shockwave therapy, and these are all regenerative modalities. And so I kind of consider it kind of a regenerative stack. And so what I tell my patients is, you're doing really well using the regenerative modalities that we're offering here in the office. I'd love it if you could could continue the benefits of this at home with a red light panel. And so, and that's exactly what I've done, is just basically prescribe it. And then the Red Vive team has just come in and been amazing in terms of providing the support and follow through with the patients to make sure that they get the device that we're prescribing. And so it's very much just like anything else, whether it's I prescribe it like any other modality or prescription medication or anything. I show my patients this is a prescription that I'm going to write, and then the Red Vive team follows up and educates the patient and contacts them and sets that up. And so it's been a great revenue, cash service revenue generator for my practice as well. So it's been very much a win-win for my patients and for myself and my practice.
Awesome.
I'm utilizing it for everything from diabetes with neuropathy, inflammatory pain, even things like patients coming in and getting it and being seen for plantar fasciitis, and they're getting, shockwave or laser therapy. But I had an incident where a gentleman came in, he was getting the treatment for that. And then he also had shingles outbreak, and everything on the left side of his body was affected. I put him up against the Red Vive, and immediately that day he bought in the large panel because he felt the effects of it right away. So it's been a great addition to what I already do.
Amazing. Yeah, we're seeing that there's a few different ways that we can do it, and I know Dr. Ho is also integrating it with her regenerative medicine stack. And so oftentimes, if it's something that we have this compilation of therapies that we're using, regenerative medicine, photobiomodulation, peptides all together, patients love that because the outcomes are going to be that much better. So I'll jump back into kind of the science. My introduction was not actually in the clinic or the lab, in my clinic or in a lab. It was across the street. There was a wellness and performance center. They had a $150,000 bed. I went and got a membership. I love tech and all things new, and immediately felt better. It was awesome. I was like, this is incredible. I had better sleep. I was using an Oura ring. I was tracking it. I like data. And I just felt, improved energy, reduced anxiety, better sleep, general sense of wellness. But unfortunately, even though I had those immediate benefits, it was somewhere where I had to go, and it was a subscription service. And over the course of a couple of months, I stopped using it. And, it was years later that I realized it wasn't the medicine that was failing me. It was the dosing pattern. It was how we were using it. And it was just too challenging for me to get to that, other place, right? It wasn't at home. It maybe wasn't in the gym that I was visiting all the time, but it was somewhere where I had to go to get this delivery. And if you're delivering, and we had energy-based medicine in our office. So we had shockwave, we had M-Sculpt, we had laser, we had PEMF. I never bought that $150,000 bed because we could never make it pencil, right? And then so we didn't offer. So I sent a lot of patients to different performance centers, and they were getting this. But what I realized after years was really about the dosing. And the reason why that even came to fray was this gentleman sitting in the chair. There's one of the owners of Red Vive, Matt, and he came to me with this panel. He had probably 6 or 7 stem cell therapies from me. He's an ex-MMA guy, had beat up his body, really benefited from stem cells, and was into biohacking. And he brought me this panel. He said, Doc, you got to try this. So I was skeptical. I was like, this is $2,000. That thing's $150. That has to be better. And so I said, skeptically, I took it home and I started using it. And as soon as I put it on, I felt the intensity and the power of it. And I said, wow, this is really good. Like I'm feeling a similar sort of energy, reduction in pain. And I'll talk a little bit about my story, but it was almost immediate. And the other thing is it was at home. So everybody else started using it. My kids, that's my daughter, injured herself in track and field. My wife is using it. She's a big time hiker, had some foot issues. My kid, as soon as that light comes on, he falls asleep. And there's a reason for that. It's wonderful for sleep entrainment, circadian entrainment. And so everybody started using it. It was kind of the hub that literally sits in our living room to this day. And so it was really powerful. And I said, okay, this is kind of cool. And then Mike and Matt said, hey, would you implement this into your practice? Like, do you think, based on your understanding? I said, I know a little bit about it. I don't know enough. If I'm going to do that, I need to get trained. So if you guys support me, I read every book I could. I listened to every podcast. And finally, I found this World Academy of Light Therapy, or WALM. And I said, okay, they have a congress every few years. And this happened to be a year they were having one in London. So I flew there, and when I went there, it was amazing. 153 lectures. And one of the things we talked about was snake oil. Like, check out these, the table of contents, the different areas that's treated. So neurorehabilitation, stem cells, regenerative medicine, PBM, antimicrobial, reproductive health, metabolic and immune, bone and musculoskeletal, acupuncture, cancer care, wound care, dentistry, pain management, dermatology, sports medicine, ophthalmology, aesthetic medicine. So you have this huge scope, and there was 153 lectures from bench scientists to clinicians, and one of the really compelling panel discussions was, how do we prevent this from being called snake oil? Because it's affecting everything, and it really came down to the science and education. That this is treating patients at a cellular level. We have to educate them, right? And that's the part why I get passionate about this, because I love teaching. And so this is why we're even having this webinar tonight, and we'll continue to educate you if those of you are interested in really understanding this medicine and taking it to the community. This is a couple of cases. I'm going to kind of fly through this just with time. This was a patient that we leveraged both regenerative medicine, so injection therapies, which you guys are getting, that wonderful introduction by the team to, I think is super powerful, and using PBM as an adjunct, really to power that to healing. And so this was a patient that they're a professional horse rider. They spooked their horse. The horse kicked them in the knee, and they tore their ACL, dislocated their patella, tore their MCL, complete ruptures. And this was September of 23. They were going to have 3 areas surgerized. They decided to come out to see us in Portland from Atlanta. And we did everything that same day, treated them, put stem cells in the ACL with very specific image guidance. I'm all about precision diagnosis, precision biologics, and precision delivery. Those are the 3 legs of the stool that allow for successful therapies. And then we see that, the MCL, which you can see here on the image, healed over the course of a few months after the cell therapy. And this is also, the MCL will heal often in the knee all by itself, but the ACL doesn't. That requires usually a surgical intervention. And that was day 0, complete rupture, 7 weeks after stem cell, 11 weeks, and then 7 months read as a normal MRI, which is mind blowing without having surgery, right? They left with Band-Aids, and they were walking within a week. Knee arthritis. Here's an area of full thickness cartilage denudation in the knee, and there's subchondral edema underneath there. The cartilage is delaminating on the right side of the images. We injected both the intraarticularly, and we put medicine into the bone, intraosseous injection of cell therapy. And this was 6 months later, where there's new cartilage growing, right? So we didn't have to do an Oates procedure, or there was no microfracture done. This was simply placing cells into the area, and then leveraging photobiomodulation to stimulate that, right? To act as an adjunct. And so this is another image of that. So full thickness defect. So cartilage can regrow. And we've seen that this is not the only case. We've seen other cases. There's another one where this was 2018, and this was a large full thickness defect in the patellar cartilage. And 4 years later, they had a post PRP for the other knee, and they wanted to see how this knee was doing because it was feeling so good. So we just scanned them and showed complete healing, and they were doing tremendously well, and they're leveraging photobiomodulation for their entire body in both knees. And here's another picture of that. So there's possibilities, right? So that's what's so amazing about regenerative medicine, and I feel like PBM is just an extension of that. So why does this light have this biologic power, and why red and near infrared, and why does daily exposure make a difference? And so evolutionarily, this is kind of amazing to me. I think it's even in the spiritual realm. I'm a pretty spiritual person, so I love this. And so why does it make sense that this red light panel makes this difference, so this near infrared? And it goes back to evolution, right? It goes back to what's the source of all life on this planet is the sun. right? And that's where our energy source. So every cell from that first bacteria that was a unicellular organism to the mitochondria that we have now to plants, everything relies on that sun, the sun energy. And the cell is a receiver and translator of light. Why red and near infrared? Why does that make, the cell energized? Why does that help it heal? What's super cool about this is that that's the light that comes to us twice a day at sunrise and sunset. So this low angle, you can see here, the person that's on the left of the screen, the sun's at high noon, right? And they're going to get direct high energy beams, right? And so the UV and the blues, the sky's blue at that time. So they're getting dosed with the full energy spectrum. At the low angle, so when there's a 15 degrees, so this person way over here on this side of the planet, either at sunrise or sunset, the wavelengths have to go through a lot more atmosphere. The blues and the ultraviolets get scattered, and they'll come through. Like in the morning, I saw this week, we had a few beautiful sunrises, just red sky. In the evening, same thing, right? So in the morning and the evening, 15 degrees or lower, you get that red and near infrared. That's what's coming through. So over 400,000 years, right, our bodies have been trained, our cells have been trained for that sunrise and sunset, and they respond to that. That's what red and near infrared, when we see it in our eyes and we feel it on our bodies, what do? We need to, in the morning, we're climbing out, back in the day, climbing out of a cave, coming out from under the trees, and we need to wake up. We need cellular energy and metabolism, so ATP production. And they've done modern day studies where they've looked at animal studies where they've looked at illuminating the tissue. And in the morning, we produce way more ATP. In the evening, what do we need to do? We need to get ready for bed, rest, recovery, right? Healing. And so our bodies respond differently. And so it's so fascinating that we have this kind of attunement. And in the evening, our melatonin production will spike with red and near infrared light exposure. Growth hormone will spike, will modulate cortisol. So all those things are in that rest and digest phase. And there's absolutely a perfectly reasonable reason for that, right? It makes total sense. So my story as a physician, we treated the entire spine, body from head to toe, regenerative medicine, and anything that we could use, like energy-based medicine, diet, sleep, nutrition, we leveraged. And that's where we were using, photobiomodulation. And we just, integrated it with our energy-based medicine platform. So we integrated those things that we had in office, right? So if you have a laser in office, you still do that. You're getting a high dose into the tissues. You can do all these other things, shockwave. But an extension of the practice was sending them home with this panel, right? So that was the beauty, that you could extend the walls of your clinic and energize their tissues and give them homework to do. And so every patient that did a regenerative medicine procedure, we stacked it. There was not a choice. They could opt out, right? If they had one, or this was another procedure and they had already had a device. But every regenerative medicine patient, we just made it easy. I believed in it so strongly that we were going to get better outcomes, that they went home with it. And that was my clinical decision, that you're going to go home with this, and I'll talk to you about how we used it. The big panels that we had, we drop shipped it. I didn't want an inventory. And as we started to work the business, this business of Red Vive developed in my clinic. And so there's some really strong opinions that I had. If we were going to do this, and I talked to Mike, who's on the phone call today, I wanted it to be easy. I wanted my staff to have minimal interruptions in their workflow, in their day. I didn't want to hold an inventory. I didn't want to buy a bunch of panels that I had to sell. I didn't want to handle all those things. I didn't want to deal with returns and issues. And so if you could make all those things work, and we were able to still benefit, financially, and we had a high level product that was going to give us outcomes, let's talk about it. And we actually started with I was worried about the cost. So we implemented this with all the patients with a rental program. And what we realized after 3 months, nobody returned it. Every single patient bought it. So we're like, okay, this rental program is not working. We're just going to include it. And so we had a nice margin. It helped the clinic become even more profitable. And so there's really beneficial. And then if any issues came up, Red Vive called, they dealt with it, any returns, and they did a wonderful job. And so we created this kind of 6-phase PBM care path. So preconditioning, as soon as a patient wants a regen procedure and they know they're on the schedule, they go home with this. They start to precondition the tissues, and we'll talk about that. They start priming it. When they come in for the day of the treatment, we do another therapy. We have a panel in the office. You can stimulate the cells, depending on if you're using whatever sort of biologic material. As long as that has cells, it's going to stimulate them. It's going to make them work better. They're going to have less inflammation, less pain, better healing properties, better cell migration, adhesion. There's tons of studies, and it's called ex vivo priming. So you can do that with red and near infrared. immediate post-procedural analgesia. When they go home, they can be a little bit less painful after a procedure because oftentimes regenerative medicine procedures can cause some pain. And then rehabilitation and tissue remodeling, that's going to be several weeks out. And then long-term wellness, which is amazing about this product, it's never going to go away, right? Dr. Twee has a new device at home, and she's been using her other one on a daily basis. And guess what? As you just learned, what's the best times of the day to use this, both when you're healing after a procedure and also long-term, is AM, PM. We've had this amazing medicine for years. I think what we're going to learn and what we're learning in our business is that the dosing pattern matters, right? If you get this medicine every day, AM, PM, it's like brushing your teeth or flossing or getting exercise. You don't exercise once a week and then expect your body to be in amazing shape, right? This is a daily experience. And so it's something that's really important. So your sleep architecture improves for neurocognition, stem cell recruitment, anti-inflammation, energy support, all of these things, and collagen building support. And why am I so passionate about it here? Because it's changed my life. So my story as a patient, we talked about it as a doctor. So I have EDS. And as you guys probably read lots of MRIs, you can see that Achilles, and I think that might have been on our email out. That was me. All right. That patient was me. That was my Achilles. I have Ehlers-Danlos. I have a Beighton score of 9. My tendons fall apart. Thank God my joints are pretty strong, but good at yoga, bad at football. All right. And so that's my tendon, treated with both photobiomodulation and cell therapy on the left, completely degenerating, horrible tear, no surgery required, normal, fixed on the right a year later. And now a few years out, still doing amazingly well. That's me on the right again. I have the same haircut as that gentleman there, but that's not me. I'm not the one on the table. And I'm getting an injection into my discs because of that laxity and tissue injury. And so I've been a patient. When I started using photobiomodulation, the next picture is actually me about 2 years ago. And this was EDS related instability, pain, loss of function, confidence. I had gained weight. I was chronically inflamed. I was always in pain. And simple things like opening up a door, sometimes I would sublux my wrist or my shoulder. So, this is not about, aesthetics but you'll see what happened because there's an external manifestation. But I used twice daily light therapy for a year and a half. And immediately I felt better sleep, less pain. But about 6 months in, I started to notice I'm way stronger, right? The things that I'd been unable to do in the gym, even with the kids, activities, all those things just became so much easier. I was not in pain. I was much more functional. I actually was reading some studies about collagen synthesis and support, and I realized that was actually happening to me. And this is this next picture, my friends tease me, this is my OnlyFans picture, but this is me currently. And so it is a cosmetic transformation, but really it's a biologic one. I feel completely different. Like my tissues are so much stronger, so much more. We talked about resilient. That's what I feel like. Like I'm able to do the things I want to do and not suffer from the pain, instability, and fear that I had before. And that's that photobiomodulation. But I truly believe it's that daily practice, twice a day, that's creating those benefits. And so when we look at photobiomodulation, right, you're taking this very specific wavelengths. And if you looked at the electromagnetic spectrum, the visible portion of that's very small, right? And we're talking about even much smaller, just a small area, right? The red, 600 nanometers to 800 nanometer, 880, 900 nanometers. Those specific wavelengths target a very specific chromophore or photoreceptor in our bodies, right? So this is the medicine. We have 4 specific doses. We chose this for our Red Vive panel because we know that that's the medicine. We wanted this specific, like an Advil for inflammation or pain. We want that. We didn't want an antihypertensive medicine. We didn't want something else. We wanted that very specific medicine. And these are the wavelengths that actually affect that photoreceptor. So we have a bunch of photoreceptors in our body, light receptors, right? Light sponges, hemoglobin, melanin, water. What we're focusing on is cytochrome C oxidase, right? That's a protein. It's on the mitochondrial membrane. And when you activate that, it promotes a very specific cascade of events that help with healing, that end up helping with healing. And there's 2 pathways in our body, from our eyes and from our tissues. So that photon, that light energy from the red and near infrared, hits that cytochrome C oxidase. It releases nitric oxide. Nitric oxide in the cell and in the tissues and the bloodstream is a good thing. Vasodilation, improved blood flow. But when that happens, oxygen binds to that receptor. And instead of making 2 ATP, during that electron transport chains, it produces 32. So it has up to a 16-fold increase in ATP production. There's so much more energy in the cell, right? That currency, it's able to do all of its processes in a much better way. There's a stimulation and modulation of reactive oxygen species. There's gene activation. And at the end, it's a cascade of events, right? And what happens is we are able to heal better. So just think about that. And part of this is I don't want to get so deep into the science. I know we're limited on time, but I want to give you an understanding of, there's a very specific mechanism that occurs here. And as we develop that Red Vive relationship with you guys, we're going to implement educational platforms at Red Vive University, and we want you to be able to speak this language fluently. But light hits this cytochrome C oxidase, nitric oxide released, oxygen binds, energy rises, and ATP is produced through this electron transport chain. And at the end, right, what's happening is healing is being promoted. Stem cells are being awakened and activated. And this is my elevator speech. I call it kind of the triumvirate or the holy trinity of photobiomodulation. What happens? We have mitochondrial activation. So that's performance of the cell. Number two, which we didn't talk about, is pain and inflammation reduction. So Dr. Tweed just talked about it, that patient that had pain reduction immediately. Why does that happen, right? It's a very powerful agonist of TRPV1 or capsaicin receptors. So if somebody's inflamed or hurting and you put that, illuminate their tissues for 5-10 minutes, they have a powerful neural modulation. It reduces the pain immediately and they feel great. If you keep doing that over time, it reduces neural inflammation and can promote nerve regeneration. So when they're looking at all the neuropathic studies, even central nervous system degeneration, that's what's happening. That's a pathway of reducing neural inflammation, which is a huge issue. And then stem cell regeneration, right? It's activating stem cells. So there's more stem cell supply and more healing potential. So this is a massive biologic amplifier. Okay. And we're going to go through this, but these are some of the slides. I'll kind of fly through these. That's the capsaicin. So analgesia immediately, but over time, there's actually reduction in neural inflammation and nerve regeneration. But that's that kind of continuous dosing. This was a study that they did in stem cell activation. They just illuminated the tibia. 2 hours later, they looked at stem cell counts in the peripheral blood from baseline, and there was an average of 300% increase in just 2 hours. And that lasted anywhere from 2 to 4 days. And then they had 1,000% increase in macrophage activity. And some other studies have shown a shift in the phenotype of the macrophage to one that's anti-inflammatory and healing. So M1 to M2, which is a big discussion point in a lot of regenerative medicine conferences and studies. And then there's a lot of studies out there on stem cell activation. So something if, the folks that are getting into regenerative medicine in their clinics, this is a very easy way to turbocharge your cells. This is a Red Vive device. You can see here there's a syringe of material there, whether that be stem cells or platelets, anything that has cellular material in there, and you can use that to activate those cells. There's a ton of studies out there for increased viability, energy metabolism, growth factor release. And these are, for all different cell types, which is incredible. And the other thing is it's very short because you're not having a lot of attenuation from the tissues. So this is a 60 to 90 second dose. So something that's really easy. It's not going to disrupt workflow, and you can help your patients even more by producing a better product. And here's an example of a study that showed it on adipose-derived mesenchymal stem cells. So adipose tissue. So what did it do? Red and near-infrared light preserve cell viability, metabolic function, enhanced cell migration, right? And it showed a consistent ability to stimulate proliferation and mitochondrial activity. And they studied this compared to blue light, and actually blue light was actually detrimental to the cell health. So the other thing that we're going to talk about is dose, okay? And so why a Red Vive device is different than others. We have the right medicine, but even if you have the right medicine, we talked about Advil as an example. If you give someone 1 milligram of Advil, is it going to help them? No, you need the right dose. You need 200, 400, 800 milligrams of Advil. So what determines the dose, right? One is the power, and that's fixed on our devices. How much energy is coming out of that device? Most of our devices are fixed. A couple of them, the newer ones, we can actually modulate how much energy is being sent out from those LEDs. Number two is distance, right? There's an inverse square law. So the farther you get away, there's a drastic reduction in the energy deposition. So we want to be relatively close. That tissue dosing, you want to be at that 6 inches to 8 inches away. As soon as you start to get farther, a foot, 2 foot, there's such a dramatic drop off, you might not be getting the proper dosing, okay? And it won't be able to penetrate the tissues. And lastly is how much time do you spend? So that's what we're going to educate you on. We have different protocols. The beauty is there's a really nice bandwidth. Oops, going the wrong way. So here we're going to talk a little bit about, and I won't belabor this, but irradiance is how much energy is coming out of the device. Fluence is how much energy is being deposited into the tissue, and that's important for different indications. And attenuation is how much gets scattered, right? So this is a kind of a waterfall analogy, is that how much water is coming over the fall, like you want that to be adequate. How much is falling into the basin or the lake is your fluence, is how much tissue, how much energy you need to make a difference. And attenuation is how much scatter, how much mist, the water that's bouncing off the rocks and getting scattered into tissue. That's that attenuation. And so the therapeutic window is the right amount of water in that basin, right? And so we want this biologic harmony. We want we don't want salt water coming over there. We want fresh water, right? So the right medicine, and we want the right dose. We want the right tissue response. And so those are kind of those dosing parameters. What are the wavelengths, the intensity, the distance, the time, how often that you do it, how many days a week that you do it. So what we see is usually a 24 to 40 hour response time. So that's why we can deliver this daily. Can you do too much is a question that we get often. And yes, you can overdose with this. If you do too much time, you're too close to it and you keep hitting it, you'll get this stimulatory reaction for a while, but then you'll go into an inhibitory region. So you can get too much. And the good news is it's not that dangerous, but you might feel fatigued. Some of the pain or inflammation that you've been benefiting from might come back. And then you just have to stop dosing yourself. And there may be some, learning curve and titration. And that's akin to like flooding the basin. You're just putting too much in and you're going to have some bad outcomes from that. Okay, but it's not horrifically dangerous. There's no burn risk. So that's the good news, that it's a very safe, class 2 medical device that can be sent home with the patients. And there's a broad therapeutic window. So we're looking at 10 minutes a day to 30 minutes a day in that optimal dose. And there's some titration. There's a learning curve and every body responds differently, right? You're stimulating somebody's immune system, somebody's ability to heal. We're all different and you have to figure out where. So you start slow or start low and go slow, and you can build and titrate. And some folks may be able to tolerate a really high dose and others may be, a little bit less. How do we know this works? Again, there's the first insurance paid indication for this, for especially using it external, like we do with an LED source, was for oral mucositis. Oral mucositis is kind of a multi phase dynamic injury of the oral mucosa that causes sloughing in kids and patients that are getting chemotherapy and radiation therapy. And it's, it involves reactive oxygen species, inflammation, vascular issues, microbiome changes, and cell regeneration pathways. Photobiomodulation is now the gold standard for that, right? It is the gold standard for treatment, both intraoral and extraoral. This is providing a multi-phase healing approach to speed recovery, right? And so that's amazing. And there's more indications. Probably myopia in children is going to be the next insurance covered indication for this. What did this provide us though? These studies that they had to do, and these are dating back to 2016, showed that LED therapy provides equivalent benefits to laser diodes, right? So that's really important, that LED PBM reduces severity, and that LED is depositing enough energy into the tissues from an extraoral source. So it can get through the oral mucosa, get through the periodontal tissue. So these are landmark studies that show that we can deliver that energy from the skin into the tissues. And so that's the interest that we have, is that it's not the peak power, right? It's the total energy that's deposited that drives the biology. So if you are doing this on a daily dose basis, you get a compounding effect, right? You get in the morning, you get in the evening. If you look at the total joules that are delivered into the tissue, the amount of energy that we can deposit becomes tremendous compared to going into a clinic once a week or every other week to get a laser therapy. Both can be very effective, but this is kind of the homework that really seals the deal. And so it's just physiologically intelligent, right? It's dose density, frequency. You get regional systemic coverage. You can cover a large area. You have a compounding effect of these photons, and it has biologic adequacy. It's reaching the same depth. So healing response to total energy, not peak power, right? And so this is a cumulative effect. It's super easy. It fits naturally with treatment. It's not hard. It's used wherever biology is stressed. Dr. Twee talked about that. So when patients are inflamed, they're in pain, you need support for regeneration or healing, just think about, when is the tissue stressed? Patients are seeing you for that, right? If it's a wound that's not healing, the biology is stressed. All of these indications can be benefited from photobiomodulation, and it's an adjunct, right? It's helping push it along. You might require other therapies, but this is something that's going to help change that baseline. And what we've seen is that twice daily treatment, 5 to 15 minutes, targeted and systemic, can provide really powerful, invisible efficiency and amplification of healing. And it's just the perfect adjunct. Mitochondrial ATP production, angiogenesis, oxygenation. It helps with collagen synthesis and remodeling and pain modulation. Right? And so really elevate outcomes, expand revenues, empower the patients. And so these are just some studies. We created at Red Vive University. I'm not going to belabor this, but they compared shockwave to laser, low-level laser therapy, low-level light therapy, uses on diabetic wounds. You saw benefits there, all non-healing ulcers, and all of these are light-emitting diode studies. Here was neuropathic pain. And these are some other things for arthritis, for tendinopathies, for musculoskeletal conditions, for pain and inflammation. And so if anybody is interested, this is what we've created, Red Vive University. We've compiled the articles. They're the full articles. There's abstracts, the year, the type of research that's done, and we have, categorized all of these. And so this is available to anybody that joins our program. And so it's something that's really helpful. We have these podcasts. You should definitely listen to Tweez. It's awesome. And then we've had medical team talk tracks, medical protocols. So we really want to make this easy for you. And so this is this is a process of weeks to months to get you guys to that expert level. But that's my passion. That's our passion, to really bring, this partnership to you. And so not all devices, not all companies are created equal. And so we really feel that this is, an amazing opportunity to work together. And we're bringing that photo business modulation to you, and now pairing up with Amex, I think, is an awesome opportunity. And so, bringing that clinical use integration and, using stacked services. This is a PBM system, Red Vive system, that you can take a look at. That's the website that we have that can help you understand this process. And, this is kind of our initial experience package, really to bring it home to you. What we found was that, the docs we were giving one panel or selling one panel to the doctor. The physician would take it home and it never made it back to the clinic because they loved it. They were using it like mine. That's not going to come back. And so we realized that we actually need an experience package because we want your patients and your staff to experience it. So we started this, and for you, it's a half cost value. That there's 2 large panels, 5 small panels, and the 2 large ones comes with stands. The small ones can also fit to the stand, so you can use it for different indications. We have a lot of the dentists that are using that for like oral applications. But I'm going to hand it over to Justin. I know I flew through that, but I wanted to get through everything and give some time for Q&A. And I like to talk, and I could probably talk for hours, so I needed to be abbreviated. But thank you so much for your time.
Yeah, as you all can tell, Dr. Desai can probably, he can probably do a 7-hour presentation about all this, and he's a wealth of knowledge, and he's there to help everyone. So that's the great part about teaming up with Red Vive. Like Dr. Desai mentioned, we have a special going on this webinar today for the experience package. On the next slide, Dr. Desai, I believe you have a QR code. So if you scan that QR code to the left, that will bring you to the website to automatically get 50% off MSRP on the website for that experience package. If you guys get to the point where, or if you're like, I don't want to do the $5,000 package, I just want to do one panel to get started, you can certainly do that too. That would be 40% off to you. So super easy to integrate into your practice. As always, you guys know that we're here. We have John. You can text, email, call him, anything you got to do to get his attention. And we're here to help. And then obviously, if you're like, hey, I just want to learn more and how to incorporate this into our practice, we also have a QR code on the right-hand side there. You can set up a call with Dr. Desai, and he's going to obviously give you guys all the tools that you guys need to get set up and be successful with offering Red Vive to your patients.
Can I just comment that if you guys are already doing some sort of red light therapy, laser therapy, whether it's REMI laser or MLS laser, the patients can visibly see the near infrared light that those units are already emitting. So if you're already using it and you're seeing the benefits of it, you're already a believer. And so I think it's not that hard to tell your patients, okay, so what we did for you was a much more like deep penetrating, but the red light component that you could see, the near infrared light, that part you can take home and continue. So I think patients love that. And for me, I'm exactly what Dr. Desai said. I took my panel home and it never made it back to my office because I loved it. For me, I think for my neuropathy patients and my patients that have either Raynaud's or you're diabetic with atherosclerosis, they love this stuff and it's so safe. I don't know about you guys, but in Texas, like when we had that snowmageddon and the freeze and the cold, this is an amazing panel. This is where my patients see the benefits of it. You can feel the emitting warmth of it, but they're getting the full angiogenesis component of it. And so here's an opportunity from them to get like that warmth and that treatment, but while getting the full effects of the red light. So there's so many ways that this can fit in your office, whether you decide to let the patients try it for free, or they can, you can include it in your laser packages. There's just a multitude of ways that you can incorporate this into your practice.
Awesome. I think we have some questions, John. Do you want to ask Dr. Desai some of the questions that came through?
Yeah, sure. So it seems like we're getting a handful of questions about if you screen for cancer, should we not be treating patients that have active cancer?
Yeah, it's a hot topic. Our party line right now is if there's active cancer, do not treat. There are studies that are coming out that actually are using red and near infrared light, these specific wavelengths, as adjuvant therapy, right? Not adjunctive, but adjuvant, like cancer treatments. And they're used with cisplatin. And a lot of the indication is that this actually causes kind of asymmetric apoptosis of cancer cells. But we don't know that for certain, right? And so the concern is, we're creating blood vessels, nitric oxide release, better blood flow, all those things. What happens, in that scenario? We don't want to like promote metastasis, and those are the concerns, right? And so it's just easier right now when there's still a bit of an unknown to say no cancer patients. Or it would have to be very specific with their oncologist's blessing. But we know that there's more and more studies coming out. And that was some of the sessions in Europe that we went to. There's the folks that are really leveraging this and using it. They're actually using it with cancer patients. But our party line for to just keep everybody safe is to say no. The other big contraindication is pregnancy, and that's especially over the womb. No photobiomodulation. If they want to use it on a knee or a foot, or for swelling of the lower extremities or other indications, they can use it, but just nothing over the womb. Those are probably the two big issues. If somebody is highly photosensitive, and most of the time that's the high energy spectrum, like the blue light and the ultraviolet, that you might test dose them. And so somebody says, hey, I'm really sensitive to sun, I get rashes, then have them come into the office, and most, we're going to have you set up with something, give them a small test dose, start with 3 to 5 minutes. And if they have no issue, then you can kind of increase that. And if they're doing well, then if they want to, they can take one home. Okay. But those are probably the big things. But, we've had questions like pacemakers and other devices, no problem. They can use it for all of those things. Eye health, you want to, if you're doing face exposure, then again, a little bit of CYA, use the goggles, especially if you're doing anything over 3 to 5 minutes. We have like the face masks that patients will wear for, 30, 40 minutes to get enough dose. With these panels, you'll get enough dose or a very similar dose within 3 to 5 minutes. And so, I use it, if I'm going to use it for either transcranial photobiomodulation for anxiety and brain health, then I'll do that, and I'll just close my eyes, right? And it's very safe for that. If you're going to do 20, 30 minutes, which I would not recommend for your face, then obviously you would want to protect your eyes.
Perfect. Is the amount of light more on the bigger panel, or why the larger one over the smaller one?
Yeah, the light.
Why would someone choose the larger panel over the smaller panel?
Yeah, just total dose, right? The energy is pretty similar. The bigger panel does provide a little bit more energy, That's the one I leverage at home. I like the small panel. I actually travel with that. I've become so used to it. I need that light therapy. But mainly it's just the dosing, right? Because you're getting that large area. So what's emitted from those bulbs is very similar individually, but you're getting 300 individual doses versus 60 from the smaller panel. For specific use cases, like if you just moved it over your body, you'd get the same dosing. It's just going to take a lot longer. Does that make sense? So the larger panel is delivering more energy per unit of time, but around the same energy for that specific tissue.
Perfect. Is this used for toenail fungus?
No, there's some early studies, but we have not leveraged it for that. But if there's interest, I can always do a PubMed search or educate myself with you. So there's so many indications, and I'm not familiar with all of them. And this comes up for all of our different fields, and so part of it is learning together. So I say no, but I would have to make a deep dive into that. But I haven't seen anything.
This is a good question because I know this is something that you're working on. Are there studies for hair growth?
Yeah, but it didn't work for me. No. I started like when I was 25 losing my hair, so it's been a long time. Yes, there are studies for inflammatory hair loss and androgenetic alopecia. Obviously, it's going to be, you got to start it early enough, but the only three things that are like FDA approved or indicated and have studies demonstrating benefits for hair right now are finasteride, minoxidil, and red light. And so it's the dosing. So ours definitely, we're in the right wavelengths to help. And then it's that repetitive pattern. So definitely, and then we're actually looking at some other form factors like a hat. But we want to, again, deliver the right wavelengths and the right energy spectrum. We want enough dosing. But yes, it can help with hair loss, but also looking at kind of a multimodal approach is probably your best. And I'm a big believer in regenerative medicine. I've seen what, my wife is a dermatologist and she treats a lot of alopecia areata, and they do regenerative medicine injections into the scalp, and it can be a really powerful adjunct. So you can kind of stack these services.
So I'll ask this for both of you guys. What do you guys think about using this in conjunction with DPMX?
Fits right in. I mean, it's exactly what I think all of these, and that's one thing I advocate to my patients is that, sometimes it's like saying, hey, I've got plantar fasciitis, and then, is an orthotic alone going to work? No, orthotic with a good stretching stretching regimen with the right shoes, like all of these things, it's a comprehensive protocol. And I think this, if you are trying to place yourself as the regenerative center in your area and you are doing all these modalities that are regenerative, this fits right in.
I agree. I think it's looking at all the different modalities. When we first started doing regenerative medicine, it was simply, I'm a technician, right? Musculoskeletal radiologist, interventionalist. So do the injection, do that. What we realized over time is the healthier the patient, the better clay that you're working with, the better art you're going to make. We just started to stack on like simple things, sleep, nutrition, even fasting. Like fasting has such powerful systemic effects on stem cell activation. It's hard not to eat for a week, but it can be an amazing like detoxification, reducing inflammation, boosting stem cells. Your body's primed, right? And so these are other different ways of kind of doing that it's a little, less invasive, a little bit easier to do. But all of those things, if you can stack them, and we have patients they're going to, as you start to get more and more into regenerative medicine, at least that's what I noticed, and I'll ask you the same. The patients that come to us are so much more accountable. Like they want to know, they've done their homework, they're spending their hard-earned money to get better, right? And they have choice. They have a choice. They can come to you or they can go to anybody else and get that 100%. Same thing done. So
I mean, ChatGPT is an app on everybody's phone now. And that's what they're going to ask. And they're going to go to the person that has all the, all the modalities and resources. And, and I think it's really important to stand out as at the forefront of these regenerative modalities that are available. People are coming in more educated, hungrier, more demanding in what it is they're looking for. They're coming in already educated.
Yeah.
All right, we got time for a couple more. So what separates Red Vive with other brands of red light like the ones found on Amazon?
Yeah. Great question. I mean, the first thing is the medicine. Those specific wavelengths are critical. So you don't know what all the other wavelengths are in the devices. So that would be one thing to look at. There's a lot of companies that they throw in a blue light, which we actually see could be detrimental. They throw in, green and yellow, and they also throw in the near infrared, like higher wavelength into 900 and 1,000. And actually they're creating heat, right? Why does even a near infrared that's 900 or 1,000 nanometers, why is that not ideal? Is because it targets water. It's not targeting cytochrome C oxidase anymore. It's targeting water, and it heats the water. So if your goal is to heat the tissue, then you want a 900 or 1,000 nanometer dose. Or if you want a near infrared sauna, perfect. Or a far infrared sauna, right? It's heating the tissue. So those are one thing. Number two is the dose. How powerful is the light? So we've third-party tested our devices, and we measured, and they're actually what they were saying we're delivering. That is a huge unknown. There's a lot of panels that are way underpowered, and you could sit in front of it for hours and not get enough dose. So remember, medicine and dose, and then the other is the quality. Like this is a super well-built, very reliable device. If you see it and feel it, you guys have seen the devices. I mean, they're super solid, really well built. If we look at for a home setting, it's going to last. I put in, kind of did the calculation. It's like 500 years. It's going to last the bulb. So the device is probably going to break before the bulbs go out, but they're really powerful devices. So those are the big things that are separating the device. The other huge factor that we talked about why we're here on this webinar and why this team is here is the support, right? We want, Dr. Ho just said, patients are going to come to you and ask questions. I feel like it's my job to educate the providers, and it's our team's job to support you. And that's what we have, a wonderful team to help that. And now even a better, even more folks that are passionate about regenerative medicine. And I think that's those things are the big factors.
All right. Thank you. Let's see here. Can you activate RPA, which is acellular, with the Red Vive?
We're not sure. Based on all the science, it's probably not as effective as treating cellular material, right? Like we want to focus on the mitochondria and the cytochrome C oxidase. There are some studies we're looking at. I was talking to one of the companies about exosomes and how photobiomodulation may affect that, but we still don't know fully. But any cell like platelets, stem cells, those are the ones that are going to have the most effect.
All right. So last one, does this help with MS?
It can. So neural inflammation, right? So it's going to support that neural inflammation. You still may need medications, and you still may need, diet, whatever you're using, stem cells. There's lots of different indications for that. But the pathogenesis of MS, that inflammatory component of the central nervous system, this should benefit that. And there are studies indicating that, right? And so that's one of the big thing in neurodegenerative disorders and neuroinflammatory disorders. It's really interesting. And that's why you're never going to put this device away. One is this direct soft tissue. So if you have an injury in the foot, you're going to illuminate the foot. But when you do the abdomen, when you do large body areas, you're stimulating systemic pathways. So there are lots of studies for Parkinson's, Alzheimer's, neurocognitive decline, and what they're showing, and even MS, and what they're showing is both transcranial activation is really important, but as equally as important and potentially equally as effective is stimulating the abdomen. And there's there's a gut-brain axis and a lot of immune cells that get activated within the abdomen. And what they've shown is activating the abdomen. They're similar, even if you don't do transcranial, there's similar improvements in patient outcomes. So super fascinating. But yes, it can definitely be leveraged for the plethora of neurocognitive issues or nervous system issues.
Well, one last one, because I think we wanted some clarification here. So are you actually treating your PRP or regenerative medicine with the red light therapy prior to application.
Yes, that's the ex vivo priming. So that's something that you can do in the clinical setting, and I can get everybody information about how. But very simply, both red and near infrared, 6 to 12 inches away for 60 to 90 seconds. So it's very minimal workflow. If it's in a clear syringe, you're going to be able to activate those cells.
Can I comment real quick? I just did a charity event this past weekend, and one of the auction items was for red light sessions, and they said 3 sessions valued at $300. There are red light centers everywhere, and you know, patients can go there and kind of like what Dr. Desai said, that's how he started. And I know, John, you were doing the same thing. You were signing up as a membership.
Yep.
And now what I tell my patients is this is a medical grade red light panel with near infrared and red light. And you're getting a unit that's at home that everybody in the family can use. So you're not having to sign up for a membership and people are charging anywhere between 100 to 200 per session or monthly memberships. And, you know, with that, a patient can put that money towards their own panel and use it, you know, indefinitely.
Yeah, it's such a great product, guys. You're going to send them home with this to help with whatever foot and ankle ailment they're dealing with. And then the applications that they can use are just so much beyond that. So it's something they're going to use for better health for a very long time. So with that being said, if we did not get to any of your questions, I know we tried to answer them all. You guys have our contact information on the screen here. I want to thank Dr. Desai and Dr. Ho so much for sharing their insights with us. And thank you for putting this on. And thank you as always for everybody attending.
Yeah, absolutely. Thank you guys for being here tonight. Thanks to everybody that helped put this together. Email me any questions about Amex stuff or red light stuff, and I will forward it on. And we will see you next week. Thanks, everybody.
Thank you, Dr.
Hey,
Desai.
guys.
Thank you, guys.
Thank you,
Thanks,
Dr.
Sam.
Ho.
Bye, guys.
Thank you.
Bye.
Bye.